In our poster, we present the safety and efficacy results from cohort 3 of CheckMate 920 trial, which evaluated the role of Ipilimumab and Nivolumab combination in the first-line setting for patients with advanced renal cell carcinoma and brain metastases. In general, CNS metastasis is reported in about 3 to 17% of patients with advanced RCC, and these patients mostly are excluded from previous trials, although they have poor prognosis. CheckMate 920 is a multi-cohort study evaluating the role of Ipi-Nivo in the first-line setting for patients with advanced RCC and clinical features which were mostly excluded from phase 3 trials, and cohort 3 of it focusing on the patients with brain metastasis. The primary endpoint was to evaluate the incidence of high-grade immune-mediated adverse events, and then the key secondary endpoints were characterization of these high-grade IMAEs and looking at investigator-assessed objective response rate, duration of response, progression-free survival, and time to response. In our poster, table 1 shows the baseline patient characteristics. The majority of these patients received treatment to their brain metastasis before starting the systemic treatment, mostly tactic radiosurgery or whole brain radiation or surgical resection. With a minimum study follow-up of 24.5 months, all patients discontinued treatment, most frequently due to disease progression or study drug toxicity. We did not see any grade 5 immune-mediated adverse events, and grade 3 or 4 immune-mediated adverse events by category in all treated patients were diarrhea or colitis in 2 patients, and hypophysitis, rash, hepatitis, and diabetes in 1 patient each. Of all treated patients, 35.7% of them received corticosteroid treatments with doses equivalent to 40 milligram of prednisone or higher for any grade IMAE. And the median follow-up for survival was 26.3 months, and the investigator-assessed confirmed objective response rate was 32% in 25 response evaluable patients. No patients received complete response, but 8 patients had partial response, 10 patients had stable disease, and 6 had progressive disease. The median progression-free survival in all patients, all treated patients, was 9 months, and median overall survival was not reached. Interesting, of the 28 patients in cohort 3, 7 of them experienced intracranial progression, where 2 of these 7 had both intracranial and systemic progression. So in general, the safety profile of Nivo plus Ipi in the first-line setting for patients with advanced RCC and brain mets was as expected, and no new safety signals have emerged. And consistent with the CheckMate 214 data, our data adds to the limited data in patients with advanced RCC and brain metastasis and provides clinical evidence for this combination as a treatment option for these patients.